Hi, I'm Neil Treitman, founder of Cambium Wellness, back with Dr. Seibel, professor at University of Massachusetts Medical School and founder of Health Rock. How are you today?
I'm great.
Good, good. One of the things that we're struggling with keeping healthcare costs down today is the inappropriate use of emergency rooms.
Mm-hmm.
People can't get hold of their doctor, they get frustrated, they run off to the emergency room, and it costs the insurance company between 5 and 10 times what it would cost if they could act in or have waited, right? You've just written a new book about Save Your Life.
What to do in a medical emergency.
Tell me about that.
Well, it has to do really with what you're talking about. People don't always know what to do in a medical emergency. They don't know what is a medical emergency. They don't know when to call 911, and they don't know what to do after they call 911, and that's what the book is focused on. And it ties into your question, is how do people know when to call 911 and when not to?
Okay, well, so I have a headache, and I waited, and I waited, and I waited. Now it's like 7 o'clock at night.
Mm-hmm.
The headache's not going away. It's getting worse, and I call my doctor's office, and I get this recording that says, if this is a medical emergency, dial 911. What do I do?
Well, I mean, realize that your doctor is responsible for your welfare, your health, your care. That's part of your arrangement, your agreement. So if your doctor is not available because the office is closed, then of course they have either themselves or someone else that's going to be available for you. So put the call in and let them call you back. I mean, a lot of the issue is with the emergency room has to do in the first place with the fact that, we have about 40 to 50 million uninsured Americans. And then we have another 25 million Americans that are currently underinsured. So what happens is they don't have a doctor. So when they have a problem, they don't have a reference point. They don't know what to think about as where to go. So they call the emergency room, or they go to the emergency room as their de facto default place. That's how the mentality is, because where else would you go? On the other hand, as people become insured, and hopefully as the United States moves towards a universal kind of health care where people have it, then people should rely on their primary care doctors or the person who is responsible to them. It may be that they're being cared for by a nurse or someone else.
So let me ask, I get insured, now I've got this card, but I haven't established a relationship with a primary care physician.
Mm-hmm.
Aren't there other places I can go besides the emergency room?
Oh, absolutely. You're finding right now that there's so many more places. There's community health clinics that people can go. You're finding that many of the large retailers and many of the drugstores are starting to have clinics that you can drop in on. Now, these are not necessarily for everything that happens, but usually they have a menu of about a dozen common things, that 10 or 12 most common things that people face: ear infections, the cold, immunizations. If you ask people where they got their last flu shot, most people will say they got it at the drugstore, or it could have been the supermarket. It could have been any variety of places.
All right, so specifically, before I dial 911 or before I drive to the emergency room,
Mm-hmm.
I call Walgreens.
Mm-hmm.
And I say, I've got a headache. Is there somebody there I can talk to?
Mm-hmm.
Is that practical?
No, it's not. That's not going to happen. That's not the intent of it. I think to try and answer your question specifically and for people's benefits, I mean, the question that you have to ask yourself always in an emergency is this something that's ever happened to me before? I mean, is this something that I'm accustomed to? Oh, look, there goes that thing again. If the answer is no, then maybe it is an emergency. You're suddenly having really chest pain. You have bad asthma. You can't breathe well enough. Someone's really has passed out. You don't know what's happening. Somebody's face starts to get distorted and you think it's a stroke. They can't lift their arms up. The kinds of things that go along with a stroke. If it's that kind of a situation, by all means call 911 and do it immediately. But if you know that you've got a little cut and it can wait, or you've got cramps, or you've got some kind of situation that's part of things that you've had, then going to the emergency room really is not the best use of resources. And also, you end up waiting a long time, and it's going to cost a whole lot more.
All right, so let's do some obvious things. A sprain. I was running, I twisted my ankle. How do I know? Do I go to the emergency room?
If you think you broke something, and that's what you really believe, then you should go to the emergency room. If you've got a twisted ankle and it hurts or something like that, then I think you wait and you go see your doctor.
In the meantime, I elevate it, I put ice on it.
Exactly.
And see if it feels better. If I'm bleeding, I cut myself. How do I know? How is that severe enough? When do I make the determination I have to go to the emergency room?
Well, if you put pressure on something and you keep pressure on it for 3 or 4 minutes and it keeps bleeding, chances are it may need a stitch. So put pressure on it for 5 minutes. If it hasn't stopped bleeding in 5 minutes, then it may need a stitch.
Okay. When else do I go?
Anytime that you have signs of a heart attack, which could be chest pain, it could be something that feels like really bad indigestion you're not accustomed to, it could be pain going down your arm, it could be, those kinds of symptoms. If you think that you could be having a stroke, and as I mentioned, the kinds of symptoms are with your face, one side of the face starts to droop, or you can't raise your arms. One arm will go up, but the other one isn't working. Those kinds, if you start to talk and your speech is slurred and you put your tongue out and it goes in one direction or another, those kinds of things could represent a stroke. That should be an emergency. Call 911, go to the hospital. Asthma, where you can't breathe and you can't catch your breath, that's an emergency. Diabetes, if your blood sugar is so low that you suddenly go into a coma, or you go into shock, or you get too high a blood sugar, that would be an instant to go to the emergency room.
If you can drive your own car, if you can drive yourself there, should you be going to the emergency room or should you be going to a clinic?
In general, if you think you should go to the emergency room, do not drive your car. I mean, a person should not drive themselves to the emergency room because you could faint, you could have an accident, and actually you shouldn't even ask your family to do it because suppose you did faint or you were having a heart attack, they couldn't help you. And also, if you go in an ambulance, the people there can be forewarned, they'll expect you, you'll get in very quickly. But in general, if you are well enough and you're really feeling fine, you say, I could just drive myself to the emergency room. Probably it's not an emergency.
Okay. The idea of clinics, if I Google, if I go to Google and I live in Boston and I say Boston Clinic, chances are I'm going to find a place that's more appropriate for me to go if I can't get hold or I don't have a relationship with my doctor.
Well, there are so many ambulatory, you would look for something that says ambulatory care or outpatient clinic or a well person clinic or words like that. And you're going to find, as we talked about earlier, they're going to be available at certain drugstores. They're going to be available at certain large retailers. They're going to be available in your community. Most hospitals will have some kind of an outpatient clinic. Most facilities will have that. There are a lot of places. A lot of places at work still have clinics that you can go to, depending on where you work. So there are a lot of options for people.
A lot of options that are not emergency options. So I just want to close with asking two more questions. What's a reasonable period of time to wait for your doctor to call you back?
Well, I would think that when you call your doctor's office, you should ask the person who receives your call about how long should I expect before I hear back, and they should have some ballpark answer for you. In general, most doctors are going to be calling you back within an hour, certainly within 2 hours. If you have something that you think is more urgent, then you have to tell them on the phone. But I would say that if the person isn't calling you back for 5, 6, 7 hours, something like that, that's an unreasonable period, and you should reassess the relationship with that particular office.
So 2 hours is reasonable to wait for your doctor to give you a call back. If I go into the emergency room on a non-emergency event, how long am I going to be sitting in that waiting room?
Well, that depends. You know, emergency room is, an emergency room. So if you were to go in and it was assessed not to be an emergency, then you may find that you're sitting there for many, many, many hours, because every time another stabbing comes in or another heart attack comes in or another kind of event like that, of course, you're going to be put onto the back of the line again, even if you're next. So make sure that it is an emergency when you go. And of course, if you're having some experience that you haven't had before and you think it is an emergency, then by all means call 911. And if you go to SaveYourLifeBook.com, and you can see all this information in this new book that we've just done, Save Your Life, What to Do in a Medical Emergency.
Great. Thank you so much, Dr. Seibel.
Thank you so much for having me.